Hey, I'm Dr. Geoffrey, and in this video, we will be discussing why we need vitamin D and the top 7 benefits. Vitamin D is a crucial nutrient. In fact, there's a vitamin D receptor on every single cell in our body, especially our immune system. You can get vitamin D from 3 main sources. One, your skin. As a result of your skin being exposed to sunlight, being exposed to UV rays, that helps increase vitamin D. Number 2, from foods, mainly the fatty fish like salmon, mackerel, yogurt as well. And then number 3, vitamin D supplementation. Vitamin D usually comes in 2 different forms. D2, which you usually see in plants, and D3, which is what we take through supplementation and what we make. Now, vitamin D, again, plays a role in the function of essential parts of our body. Number 1, it helps with bone growth and development. It helps prevent osteoporosis. Number 2, there is an immune cell. There is a vitamin D receptor on every single immune cell. So it helps hugely, greatly with immunity. It helps with autoimmune disorders. Vitamin D deficiency is linked to type 1 diabetes, type 2 diabetes, hypertension, glucose intolerance, and the list goes on. And this is a big one. Vitamin D helps promote calcium reabsorption in the gut. Of all the vitamins, by far, vitamin D is probably one of the most, if not the most important one. Now, let me tell you the top 7 benefits. Number 1, again, it helps with bone health. It helps with that absorption of calcium, and it's essential for good bone health and muscle health. 2, our immunity. Because there's a vitamin D receptor on every single one of our immune cells, it is crucial in our immunity. In other words, if you're vitamin D deficient, it's fair to say that your immune system is not functioning optimally. And this is a big one. 3, vitamin D helps with mood regulation. So often patients, when they're admitted to psychiatric units, and as a practicing ER doctor, I still admit patients to the psychiatric unit, but one of the standing orders is a vitamin D level. Not implying at all that all psychiatric patients are vitamin D deficient, or all psychiatric patients are there because of vitamin D deficiency. I am stating that vitamin D plays a role in depression and mood disorders, and hence that's why it's so important for us to check it right away. Vitamin D has a humongous anti-inflammatory effect. It helps with heart disease. In fact, some studies show that people who've been diagnosed with hypertension, if you simply replace their vitamin D level, their blood pressure improves. And then finally, it helps with muscle function. It helps to make sure that our muscles and that our tendons are strong as well. And this time, I mean finally, it helps with diabetes management. Look, vitamin D is essential. 2 things I recommend. Make sure you talk to your primary care doctor about making sure that you have your vitamin D levels checked. Number 2, most of our vitamin D comes from being exposed to the sun. But it's mainly the skin that is exposed. In other words, if it's a wintry period of time, usually only your face is exposed. So while you're waiting to get your vitamin D level checked, making sure that you're exposed to the sun, as much skin as possible, 20 minutes a day is essential. And you won't get vitamin D toxic from being exposed to the sun. And we're going to talk about vitamin D toxicity in the next video. If you found this video helpful, be sure to subscribe, like, or leave a comment. This is Dr. Geoffrey. I will talk to you soon. And most important, make sure you do something kind for someone.